all right, guys, it is Sunday night, and that means it is Sunday night service. And I am Dani Williamson, and this is Dr. Ryan Jones. And
hello.
I am thrilled, beyond thrilled, to have this man on Sunday night service. I have known him for nearly a decade, I suppose.
Can you believe that?
No, I can't believe it. And I've been
changed in 10
years. A whole lot's changed in 10 years. Yes, a whole lot's changed. He has, I've been trying to get him on here for about 3 or 4 years, and we booked this back in January, and here it is, 5.5 months later. That's right, he showed up. So I need every one of you to show up and show out also on here, and let us know where you're from. Hit your heart buttons, hit your like buttons, tell us where you're from, and post your questions up here, because we are going to be talking about oral health, tooth health, gut health, full body health, cardiovascular disease, the things that, fluoride and toothpaste and the proper way to use a water pick and a Sonicare. Apparently I'm doing it all wrong. So
are you surprised?
No, I'm not, because I don't read directions on anything. I just open it and do it, and it's everywhere. But anyway, guys, listen, Dr. Jones, he's been a friend of mine for a long time, and he's more than a dentist. Now, he's a fellow in the, I don't know if it's called the American Academy of Dentistry or not, but he's a fellow, like he's the big dog. He's gone through like 500 extra hours of training or sometimes more than that, years of training. I don't know what it takes to be a fellow. We don't get to be fellows in my world. But did you always know you wanted to do this? I mean, dentistry, yes. Did you know you were going to step out and get into more of a functional medicine approach to dentistry? Really?
No idea.
And you fell into that, or
that was all
years?
Just taking this job with Dr. Foley.
Yeah.
Getting exposed to it.
And Dr. Foley is the one who took 9 amalgams out of my mouth, probably clear almost a decade ago. You were here.
Mm-hmm.
Yeah, you were here. And he has that practice, Nashville Restorative Dentistry. And I'm just telling you guys, you are in for a treat tonight. His wife and their 2 children are just absolutely precious. And so let's talk about it. I mean, here you are practicing. Do they call it holistic dentistry?
Yeah, okay,
what do they call it?
Okay, so
what is it? Because it's like me. What is it? Is it functional medicine? Is it holistic medicine?
Like
Am I
labels?
Practicing?
I don't either.
I'm just practicing common sense, practical medicine over here.
So you'll hear holistic, you'll hear biological.
Yes, biologic dentist.
Those are kind of the two main topics you'll hear along this. But we do. Our aim is to do world-class general dentistry. We're general dentists.
Ooh,
and we want to
dentist.
General.
Oh, general. Gentle.
We can be gentle, but general. We're not specialists. We're not specialists.
Gentle.
But we do.
But that's important, because gentle. Oh, yes. In the dentist office, people literally have panic attacks.
Yeah, a lot of sedation.
Do you want to know that the first thing that people give up when they go through financial crisis, you may know, I'm sure you know this, is dental care and eye care. They don't go to the eye doctor, and they don't go to the eye doctor never freaks me out, but the dentist freaks people out. So they just stop going.
Well, and you can layer a lot of reasons on why you don't do something. So
yes.
There can be a lot of excuses and stories stacked on why you don't want to go to the dentist. So our goal and lines we use all the time is to redeem your profession, or your opinion of our profession. So
I wonder what the problem is. Why
it's a personal space. It's a sensitive area. It's very vulnerable. One of the favorite things I ever heard was, so you come in for your new patient appointment.
Yes.
We sit there for half an hour and tell you everything that's wrong with you, and then hand you a bill. It's like if you equated that to a first date. I insult you for half an hour and then make you pay for dinner. You want to go on another date?
No, I don't want to go on another date with you.
So trying to engage in a non-confrontational conversation where someone is really learning about their position and what their choices are, to where they're not really told what they have to do. And part of my biggest journey, you asked earlier about how we end up here, how we end up doing this. Realizing that you don't know all the answers to everything, and being open to not shaming someone for being out of the box a little bit. How much do you learn from your patients?
Oh gosh, every day I learn so much. No.
So being open to have a conversation with someone to make them not feel like they're a thorn in your side or a kook for asking questions. And everything that we do is like, patients have to be their own advocate.
You bet.
They've got to be a part of their care.
You bet.
We're not here to flat out tell people what they have to do. I don't want them to sway me in what I tell them their options are, and I don't want to sway them. I want to empower them to make decisions that line up with what their goals are.
That's right. And general dentistry, and I think a lot of people think that maybe you don't practice. Absolutely.
Can I just get a regular filling there? Like
or just get your teeth cleaned.
Yeah.
I think a lot of my patients sometimes don't realize that you all just. If you don't need a filling, then you get. My children have gone here for nearly a decade, and we have our teeth cleaned every 6 months. Is that standard every 6 months? Is that what we're supposed to do every 6 months? Do people? Most people do that.
Some people can go longer than that and not have a problem. Some people that either have dexterity challenges or just aren't doing the deal. I mean, we'll see every 2 months. I mean, there's not. I mean,
Really?
how many different types of people are there out there? Like, how can you clump them all into like 2 options? It's all need-based.
Yeah. Okay, cool.
Customized.
Well, let's get started talking about this, guys. And so, you put your questions up here, and we're going to just start off talking. What I do for a living is help people decrease the inflammation in their body by healing their gut, right? And by working on their leaky gut, decreasing their food sensitivities, finding out their food sensitivities, things like that. Do food sensitivities affect oral health at all? Do food clearly affects oral health? And so most likely sugar would be the big one. I mean, I don't know. Talk to me about it.
So, Roxanne and I were talking about
that was such a good interview.
I had just seen we see all these Facebook videos that the headline grabs your attention, and then you waste 4 minutes of your life watching a video that skated around the actual topic they said they're going to talk about. And it was talking about gluten and how it can affect oral health. Now, look, I'm not a gastroenterologist. There's a ton I don't know about gluten, digestive health, and how it affects the body. But you can have oral health issues and have a gluten problem. But I'm separating them. Okay. Like, you're not having a stomach problem that is creating a mouth problem. You can have like a horrifically unhealthy gut and still have a healthy mouth. Okay. Good. If you manage plaque. Okay. That doesn't mean your risk profile is the same as someone that didn't have those problems. But what's going on here is not necessarily affecting what's going on in your mouth. When we're talking about inflammation, the main things that we're looking at, like how we're aimed at not allowing anything that we're in control of or can affect oral health wise, is not negatively affecting your cardiovascular health, your systemic disease risk, your autoimmune disease increasing factors. Main components of that: gum disease, so gingivitis, periodontal disease, and infected teeth, abscessed teeth. So those are the main components of bacterial-induced inflammation in the mouth, and how that can in turn, those bacteria are entering your bloodstream, and then it's a cardiovascular problem. Then it's a systemic problem. So the mouth and the heart are connected. Significantly. Well, let's talk a little bit about that, because that's interesting. So the most studied link between dental health and systemic health in the literature is periodontal disease, so gum disease, and cardiovascular disease. Heart health, or like heart attack and stroke by untreated periodontal disease, which a significant percentage of adults in America have some degree of oral inflammation. That's probably the most documented literature link. Did you all pick up on that? Untreated periodontal disease or inflammation or infection in the gut, a direct link to cardiovascular disease like heart attack and stroke. So if you've got, the mouth's a filthy place, 600 to 800 species of bacteria. A lot of them are 600 to 800 species of bacteria. A lot of them are fine, 12 to 20 problematic. But if you've got inflammation created by that bacteria, ulcerated vasculature in the mouth, the bacteria gets in your cardiovascular system that way, and then it can get anywhere. So, even to the point where they're targeting as they analyze clots of stroke or heart attack victims in the atheromas, isolating dental bacteria that have no other reason to be in the circulatory system outside of an unhealthy mouth.
Wow. I hope you all listen to that. That is fascinating. My dad just had a heart attack 4 weeks ago. Well, 3 weeks ago in Charleston, South Carolina. No history of heart disease. Cholesterol was good, all that. That's interesting. But his cardiologist, because I was in the hospital down in Charleston, never once asked anything about his oral
But that's
health.
where, like, if you or your family member is, at risk, or you're concerned about, stroke and heart attack risk in particular, you guys have to read the Brad Bell, Amy Doneen book, Beat the Heart Attack Gene.
Yes, that is an excellent book.
And part of their screening protocol is you have to get a CT scan, a cone beam CT scan, evaluate for abscessed teeth, and you've got to get dental exam to check for gum disease.
And you have the cone CT scan here. Right?
Yeah, can't practice without it.
Yeah.
There's no way to know if you've got an abscess without it.
You were like the first person in the area to have that, right? I think so, or
I don't know.
tell people that.
It's become significantly more common, but I mean, it's still
years ago. You've had it for a while.
Yeah, we're on our second right now. I mean, it's a huge investment, but it is, you can't diagnose what you can't see, right?
That's exactly right.
Be able to see it.
And it's a game changer. So gingivitis. Okay. So I tell patients all the time, of course, gingivitis, right?
Reversible inflammation of the gums.
Oh, I was just going to say, itis means inflammation, right? That suffix is inflammation, arthritis, thyroiditis, gingivitis, gastritis, colitis, vasculitis, the list goes on and on and on. That's inflammation that you weren't born with.
Correct.
Right? We turn on that itis. We turned on that gingivitis. What happens in our body that we turn on gingivitis? I mean, I talk about arthritis and gut and all that stuff all day, every day. But
so outside of like a hormonally induced inflammation, so gingivitis is more common in pregnancy. It doesn't mean you're going to have it. So hormonal imbalance or shift can play a part in increasing someone's susceptibility to inflammation, particularly of gums. There are certain disease processes where you can have pathology that will create inflammation of the gums. But when we talk about normal gingivitis, it's plaque mediated. So you have, dental plaque sits along the gum line. It's got a lot of bad bacteria in it, and it creates inflammation as it sits there. So that is when you have, puffy, red, irritated gums. If you brush and it bleeds, if you floss and it bleeds, that is a sign of an unhealthy tissue. So if you remove the plaque, the body is going to heal. You can take away the inflammation inducer, essentially.
So the best way to remove plaque, you go to the dentist and you also have plaque removed, but also at home.
Yeah, so plaque is soft. Plaque is a soft film.
Okay.
You forget to brush, you're in lockdown, you get out of your routine, you're like, oh my gosh, it's 8:00 at night, I haven't brushed my teeth. Everyone, you felt that fuzzy feeling.
Yes.
That's plaque. It's a soft film. You can wipe it away, you can brush it away. It's not something you have to come to the dentist to have removed.
Really?
That is home care. Okay.
What's the difference in plaque and tartar?
So tartar is
I'm just making this stuff up. This is not at all what I had on my list. But so plaque and tartar.
So tartar is a barnacle.
It's a barnacle.
It is. Yeah. So we've got a lot of minerals in our saliva. It calcifies. Plaque. So calcified plaque is tartar or calculus. So once that happens, you're not brushing it away because it is hard and it is affixed to the tooth. So that is more of the type buildup that you're having removed when you're having a cleaning. Now, yes, we're going to remove plaque, but you don't have to come to the dentist to remove plaque. If you're not removing plaque daily on your own at home, that's the problem. That's why you're getting gums that are bleeding. That's why you're getting cavities. That's the problem.
Okay. So, all right. Well, we're kind of, okay. So we're not born with gingivitis or periodontal disease most of the time or any of that.
Didn't you and Motley drink wine on these things?
We normally do, and I forgot the wine. We're drinking water. I know. We normally drink wine. It's been a crazy thing. Look at this. Carrie says, my grandmother from Germany taught me to wipe my teeth with a washcloth.
Yeah. Well, same thing, moms with kids, particularly those of you that are breastfeeding at night. Like if you're not going to sit there and brush their teeth right after it, get a washcloth and wipe the teeth. Wipe the film off there. Get the lactose off the teeth, get the sugar, whatever it is, get the film off the teeth. Not going to have a problem.
I guess I did that when my kids were little. I don't know. But okay, so that's fascinating to me. Okay, brush your teeth. What about flossing? Yes, we're supposed to floss all the time. I had a dental hygienist tell me one time, you only floss the teeth you want to keep, Dani. And I was horrified because I hate to floss. Yeah.
So
I wonder what the statistics are on flossing. I wonder if people,
everybody lies about it too. So I'm sure it's embarrassingly low. But here's the deal. Some people never floss and never have problems.
Okay. All right.
Some
So
people,
listen to this. This is good information.
Some people floss or they're just very focused on their oral care and they are more predisposed to have issues. So there's a lot that goes into that. It's your natural resistance to things. It's the dysbiosis or lack thereof in your mouth. It's your enamel health or the resistance to demineralization. There's a lot that goes into that. But floss is removing, outside of like if you've got food stuck between your teeth.
Right.
Okay. Like that aside.
Yes.
The importance of flossing and not getting cavities or having gum health issues is removing the plaque that's in between the teeth that brushing isn't going to get. You brush the bristles of your toothbrush are not getting in between your teeth. Okay. So flossing or water pick, air floss, water floss, things like that. Those are the means by which you disturb the biofilm in between the teeth. Okay.
Okay.
So statistically, like study-wise,
yes,
if you use a water pick the right way, it's going to be better than manual flossing.
Better than manual flossing.
Yes.
Okay. Well, I was going to save this for the end, but let's talk about water picks and Sonicare toothbrush, because I have both of mine from you here.
Yeah.
I use my Sonicare every day.
Yeah.
My water pick, I can't stand that thing.
You got to use it the right way.
Okay, so
no tool is beneficial if used incorrectly.
Okay, I want you all to hit the thumb down sign if you don't like your water pick, because we're going to learn how to use it. There's too stinking expensive.
You're going to go on their website and watch the how-to video.
Okay, we're going to go. Okay, Mary says, I love my water pick now. I use it all the time.
Way, it's phenomenal.
So what do you do? Because it's water all over the bathroom. Well, what do you do to make it not go there?
Don't spray that in your mouth.
I think the water maybe I should shut my mouth more.
You're gonna be over the sink. It's gonna drain down into the sink. You're not like walking around with it like you are your toothbrush.
I can't. Well, you can't walk around with it. It's got a short cord. Do they make one that's?
They make travel ones that are smaller.
Travel water picks. That's a nightmare to me. But okay, I'm going to use my water pick tonight. So tell me this
correctly. Watch the how-to video.
Shut your mouth and put it in. Okay, and it feels really good when you do it.
The angulation of where you're aiming at.
Angulation. I don't even know how to spell that. Angulation. That's a great word.
The goal is not shooting it up into the gums like a lot of people think.
Yeah.
You're shooting it between the teeth. So it's a perpendicular 90-degree angle to the gum line.
Who knew that?
Watch the video.
Okay, I don't watch the video. I didn't watch the video. Can you put essential oils in your water pick, or is it?
So you can. It's great. It'll void the warranty. It's going to be harsh on the plastics. But whether you put, not that a lot of people want to do it. There's a lot of studies on the efficacy of small amount of bleach in water.
Oh.
Not necessarily saying to do that, but there is a lot of studies on the effectiveness of the biofilm reduction in implants and periodontal patients. Peroxide. Good option.
Medical grade
ozonated
or
water.
Food grade.
But it's really just the mechanical removal of the plaque. You don't need anything more than water. But there are certain adjuncts that can increase benefit.
Okay, interesting. And then the toothbrush, the Sonicare toothbrush. So if you have, maybe you don't have a Sonicare, maybe you have another, I don't know what another name brand is. What's the proper way to use one of those? Because I learned on Roxanne's interview that we were using it wrong. How are you supposed to use it? You're not supposed to brush your teeth?
The goal with a Sonicare or an Oral-B that vibrates.
Oral-B, that's it.
There's a lot of different options. You're not scrubbing in a linear direction like you would with a normal toothbrush. Okay, which can have gum health and root exposure health issues, abrasion. These are things we're trying to avoid. The plaque removal of something like a Sonicare is going to be superior to manual brushing, but you're slowly moving it, letting it vibrate along the gum line, and then there's a gentle sweeping component to that too. You're not just haphazardly brushing all the way around while you're using it, because it's not doing anything at that point. That brush head is not designed to be like just a regular random brush. So again, go watch the videos. Dude.
I'm going
Go
home
watch the
tonight,
videos.
and I'm gonna have the best teeth ever tonight, because clearly I'm not using it right. Okay, correctly. Okay, if we're talking about brushing our teeth right now, let's get in a little bit about fluoride.
Okay.
Is it the devil? Yes, we should not. What are your
So bigger topic. There's a very real difference between ingesting without having the choice of if you're doing it or not.
Okay.
Water supply.
water?
Compared to topical application of it. All right. So in our practice, we do not use it in any routine material.
Okay.
Okay. We do have a treatment kit for advanced decay rate patients that has fluoride. Okay. So there is a scenario where we will talk about its use.
Okay.
All right. You have the choice to not use it. We don't advocate its use in normal, healthy patients.
Okay.
Because we don't need it. We don't need it in our water to have healthy mouths.
Okay.
If the plaque's not there, you're not going to get cavities. Right?
Okay.
But the fluorapatite ion that's formed when fluoride is part of enamel does make it more resistant to decay. All right. But you don't need fluoride to have a healthy mouth. You don't need fluoride to not have cavities. All right. You just need the plaque to be removed. So there's a lot of products that can be used to aid your enamel health or decay resistance or remineralization that don't contain fluoride. All right. So we do not routinely use it.
Okay. Yeah, I haven't used fluoride toothpaste in a long time, but you hear it's just the devil. Well, actually, you mentioned about chronic cavities or decay. Someone had asked a question on Instagram about suggestions for children with chronic cavities who already eat pretty clean.
Yep.
And, are some children prone to this?
So, again, so multifaceted. There's so many different things that be going on there. So you can have a clean diet that still has a lot of sugar in it, in natural sugars.
Yes.
So it doesn't, the acid producing component of tooth plaque, is going to break down carbs and sugar. It doesn't matter what kind they are. It doesn't have to be Mountain Dew. Obviously anything that is, artificially sugar sweetened, like to increase the sugar component and is acidic, is a horrible combination. But what has a lot of sugar in it and is acidic? Orange juice.
Orange juice.
So there's a lot of things that are completely organic, completely natural, that can still be in the wrong person.
Yes.
Decreasing of dental health or increasing your risk to have problems. So if you don't have a developmental disorder that is affecting your enamel health, where you actually have an enamel formation problem, or like the density of the enamel is not an issue. That puts you in a whole nother, subset of difficulty. As long as you don't have salivary problems, if you've got a dry mouth, if you've got dry mouth, you're going to be way more increased decay risk. But if you've got a clean diet, you're avoiding, sugary, beverages, acidic beverages, candy, you're staying on good preventative care. If the plaque's not there, you're not going to get a cavity.
Wow.
So a lot of it is just being disciplined enough to effectively remove decay.
Right. And then in children,
and
that's
tough.
difficult in children, right?
We've got a 2-year-old, a 4-year-old. It's not like sitting there and flossing a 4-year-old.
Yeah.
That's not. So there's these great tools called gum chucks.
What?
They're like
gum chucks. Somebody write that down and post that up there. Gum chucks? And what do? They look
like nunchucks. They help you floss kids' teeth, and there's different designs. It just makes it fun. But it's
okay.
Look, if you never floss and your kid never gets cavities, great. If you're working hard and your kid is still getting demineralization between the teeth, that's where getting a product that's going to be enamel health supporting, raising the pH of the mouth, getting xylitol, nanohydroxyapatite, things are going to help that enamel remineralize and prevent continued breakdown and decay formation. And those are going to be more important in people that are at risk. Oral probiotics, not a ton of research
right
now on, optimal blend or amount, but there is reason to believe that it is going to be, neutral to beneficial.
You bet.
So different than GI probiotics, actually letting it dissolve in the mouth. They're specifically made oral probiotics.
Mm-hmm.
Okay. And the goal there again is repopulating or shifting away from dysbiosis, trying to get more of a population of beneficial or neutral bacteria.
Wow. Okay. So those children who, I was very blessed, my children didn't have a lot of cavities. Apparently I had some as an older child, but do they still put mercury in children's teeth?
Yeah.
Wow.
Yeah.
Isn't that fascinating?
It's sad.
It is sad.
Reason to. Now the FDA, I think it was in October. It's the first, or not the first, it's the strongest language that they've come out with, talking about the dangers or the risks of mercury use. They still have not gone so far as to recommend people that have it get it removed.
Oh, yes.
But, you look up that press release and the populations that they recommend not use it. Children under the age of 6, nursing mothers, people that have, kidney or liver issues, people that have sensitivity to, anyone can have a sensitivity to mercury, but it's, there's no reason.
This was in October?
Yeah.
The FDA?
Yeah.
In the middle of
Very
COVID.
Unceremoniously came out, but I think it's the strongest language.
I never heard it. I never knew it came out. I didn't see it. I have to look that up. So the FDA put a paper out in October on the people cautioning some of the strongest language he said they've had against using mercury in the mouth. Pregnant women, children under 6. Would you say?
Yeah.
People who have a sensitivity to mercury, which would you?
Kidney or
liver issues.
So,
and mercury accumulates in the liver.
But it's, a lot of countries have banned its use, for good reason. But the majority of, mercury is what amalgamates the metals that are in. So whether the silver, tin, copper, whatever is in that silver filling, the mercury is what, allows it to mix together, bind together, and actually mash it into the tooth, mold it, and then it hardens in a solid. Okay. So it's used in a lot of kids because it can be placed in a wet environment. All right. So not placing it in children 6 years or younger, and that's kind of like the primary place that I would imagine a lot of people still use it, if they're still using it. Because if you place a bonded resin filling, a white filling, and it's contaminated by saliva, it won't bond. You have no bond strength. So that's going to fall out, or it's going to get recurrent decay underneath it. It's going to turn into a much bigger issue. So amalgam can be placed in a wet environment and not compromise the effectiveness of it. So it is contraindicated in the exact population. A lot of people are probably defending its use of because it's easy to use there. But I don't know the current statistics on dentists in America that are still using it. I mean, it is significantly lower and continuing to get lower. There's just no reason for it. There's no reason for it. We've got better materials that are just as, if not more effective. It's a shame.
It is a shame. And make sure you ask your dentist if you have a child, because I have a patient who the child was back there for their cleaning. She was not brought back to fill it, or the child was back. I don't know the exact story, but anyway, mom was out here. It was a child who came out with 2 mercury amalgams in his mouth. It was a little boy. And she said, I don't want those in there. And he said, well, they're already in. I mean, it was mercury. And that was only about 5 years ago. And here in Williamson County.
Obviously be an informed consent issue.
You bet it is.
Yeah. Regardless of what was used, someone needs to go over with you treatment before it happens.
Yeah, absolutely. Okay. Somebody asked, what kind of toothpaste do you recommend? Which is glad you asked that, Cindy, because I had already gone back there in his closet or in his, whatever, where he sells, stuff, and pulled out toothpaste. So what do what kind of toothpaste do you recommend? Does everybody need something different, or is there something that's these are both sensitive here.
Yeah. So we've got two fluoride-free sensitive toothpaste options, the Times Rapid Relief or the Kiss My Face. None of the toothpaste that we recommend routine use have fluoride. Some are cleaner than others, meaning most are SLS free. this one right here. So this is a whole line. I'm trying to get the glare off here. The brushing rinse. They make a organic rinse, a toothpaste, a powder. These products that tend to be more clean. They're not going to have like that foamy feel. They're not going to have that overly like artificial, like minty. We've been so programmed to think about like what clean feels like.
Well, it's like washing your hair. We are programmed,
and
the laundry detergent, we want to open it and see all those suds in there.
Yeah. So it's a little underwhelming at first when you kind of transition away because you don't get that same feel. But
that's right.
Here's the deal. You do not need toothpaste to have a healthy mouth.
Okay, listen to that. Mary Chabinko, write that down and put that up there. Or Betsy, either one of you. Yes, he is great, full of knowledge. Yeah. Say that again.
I'm not saying don't use it. I'm saying you don't need toothpaste to have a healthy mouth. You could brush with a toothbrush and water, use a water pick floss and have completely healthy gums and teeth. It's plaque removal. Okay. There are things in some toothpaste that are beneficial to helping you control, the plaque, the bacteria that creates, gum disease and cavities, but it's not necessary to use toothpaste. That doesn't mean some people don't need to use it because it's going to be helpful. But if you're a normal, healthy patient, you don't need toothpaste.
Isn't that something? Well, yeah, if you use your water pick, right? I use toothpaste too. And we were talking about this. They do give it out here, I suppose.
We give that out in all of our
this is dental Sidon, and we sell this in our office, and I love it. But that's not economical or cheap. It's $28, but dental Sidon is loaded with. It's got essential oils. It also has herbs in it. It is phenomenal for oral infections, for inflation, it works beautifully.
God, it tastes better than Biocide.
It tastes
maybe the worst tasting stuff.
It is, but I drink. I'm telling you, during COVID, I have used Biocide almost daily, and the spray for sure in the throat. But dental Sidon is my favorite, and they do make travel ones, and
these little things. You can get almost a couple weeks out of it.
Yes, you can. Yes, you can, because you don't. And they recommend you don't swallow this. You don't spit it out real fast. I didn't mean that. I meant you don't. You swish it around in there.
Yeah,
also.
A lot of these beneficial toothpaste, like brush with it, swish with it, spit it out, and don't rinse.
Yeah, don't rinse. That's it. Don't rinse.
It stay on there. But like on patients that are more decay risk, our primary toothpaste is called Cari Free, CARI free. CTX3. It's the fluoride-free version of that, and you can buy that on Amazon. That's not something you have to get here.
Cari Free.
Cari Free. So the disease process of cavity is called caries, dental caries.
Yes,
so Cari Free. So it has xylitol that's going to inhibit bacterial production, nanohydroxyapatite, which is kind of the remineralization building block of enamel, and it's got an elevated pH, so it's going to help neutralize the bacteria. So high pH, counteracting the acidity, trying to raise the neutrality of the oral environment. So the grape flavor is SLS free, which is what I use. And I use it with my kids. I don't have to worry about if they spit it all out. If they swallow a little bit of it, it's not that big a deal. You don't need a whole lot. We're talking like pea-size amount here. You see the Crest commercial with like the beautiful double scoop.
Oh yeah.
That just makes them more money. You don't need that much toothpaste.
Wow, I'm learning a lot just about basic brushing your stinking teeth. I didn't know. Cari Free. What about brushing the tongue? So I'm assuming if the mouth, you've got 600 and something bacteria, you said in there, different types.
Well, and the majority
and
of
scraping the tongue, talk about bad breath.
Well, the bacteria on the back of the tongue. So,
on the very back of, way back there,
so
the gag reflex, like the.
You don't have to put something down your throat, but like the back of the tongue scrapers.
Tongue scrapers,
really beneficial for that.
Yeah.
And if you've got a problem with that, and there's different pathologies, or the tongue is hairy. The tongue is not smooth. It's got a lot of the papilla, the taste buds. It's bumpy. So there's a lot of place for bacteria to stay. So if you are more bad breath prone, or you tend to get like a layer on your tongue, there's a lot of different rinses and products we can work through. The brushing rinse, the rinse is fantastic for that. So it's essential oxygen. They make a ton of peroxide-based products. It's essential oils and peroxide. It's fantastic for gum health and breath. Closis, is a chlorine dioxide rinse that is phenomenal against bad breath.
I've used that with you.
Yep.
I don't know that, I don't think it was for bad breath. I think it was when I was having my implant stuff
Yep.
going on here and just to rinse stuff out. I mean, maybe it was bad breath. They just didn't tell me. But scraping the tongue is a big deal.
Yep.
I think that is the most satisfying thing because you can see the film and you know, like a candida, people who struggle with candida to a white tongue.
This is where you're always trying to walk the fine line. There's also important bacteria on the back of the tongue that actually are nitric oxide producing, which is a big thing in hypertension patients. You know, we need more nitric oxide vasodilator.
You bet.
So, you know, that's where, you know, things like Listerine.
What did you just say about nitric oxide?
Bacteria on the back of the tongue is the first place you start to produce nitric oxide.
Did you all know that? I didn't.
So, you know, things like Listerine, if you're wiping out like all the bacteria, you know, and that's, I can't explain, you know, how a product can say like it's going to wipe out bad bacteria. I mean, there's no way like the material is deciding whether it's going to take out good bacteria.
That's exactly right.
You're walking a fine line there. So that's why, you know, probiotics are a good option. You know, if you're really trying to alter the bacterial makeup of your mouth, but things like Listerine, alcohol based, you don't need it.
Wow, I'm learning so much. Well, what about whitening? What about, and that was, Melissa, that was my next question. So you read my mind on here. What about whitening?
So we use the core system, KOR. You know, there's going to be chemistry involved in any whitening agent, but this is one of the cleaner options out there. It's got to be kept cold. It doesn't have the stabilizers in it. So it'll essentially, you know, become inert, you know, neutralize if it's stored at room temperature. But it's got an at-home and in-office component to it. So, you know, custom trays where it's form-fitted in your mouth, where you can put a small amount in each of those wells and wear it. You know, wear it overnight. You know, if it doesn't bother you, it does have a desensitizer, you know, part built in because a lot of people do get sensitive with whitening agents in general. This one is designed to, you know, be less bothersome than most, but some people still, if you wear it all night long, it makes your teeth, you know, a little.
I do fine with it. I do fine. I've used it for several years.
There's additional steps that you can do if you can't make it through wearing it all night. You can wear it for an hour or two at a time, take it out, rinse your mouth out, put another application in, you know, and not wear it overnight. There's different things you can load in the trays, like in between applications. It'll help with sensitivity. So there's a lot of different scenarios you can go through to get whiter teeth. It will gradually whiten, obviously, using it at home. If you want to do something that's more like the shocking transformation or as quick as possible, doing it for about 2 weeks at home and then doing an in-office application of a stronger version of that core material is an option that you've got.
I would love that. And you just do it. And
it's about a 2-hour appointment where you go through a couple rounds of it, but you're not going to whiten much.
I'm not. Point.
No, you're getting pretty close to
Okay. All right, fine. I drink coffee, you know, and is coffee that, what are some of the worst staining things for your teeth? Coffee.
Turmeric.
Turmeric is
the
terrible.
Worst staining thing ever.
Oh my gosh.
If you ever have dental temporaries or Invisalign trays, never, ever, ever use turmeric.
You don't know this about me.
Neon
Do you
green.
remember when I, so Adam at the farmer's market from Earth Advocates grows beautiful fresh turmeric, right? And he recently just had a stroke, which is pretty sad. He's here, but he's not 110% yet. But anyway, big turmeric, he was giving us pieces and I was leading a tour at the farmer's market with my Invisalign on because he fixed my bottom tooth issue over here. Didn't think, took a big bite of the Invisalign, of the turmeric, bright orange, right? Turmeric, beautiful turmeric. Orange everywhere, all over my Invisalign. And everybody was laughing at because I couldn't get rid of it. I had to take my Invisalign out of my mouth.
We had a guy in provisionals, like redoing a smile, and he did like a couple days worth of a turmeric smoothie in the morning.
What?
And it turned those, because they're all versions of an acrylic. You know, there's different chemistries involved, but those temporaries just turned, and it looked like mellow yellow. So permanent materials, ceramics, you know, so your permanent crowns, you know, fillings, those aren't going to stain. but things that are temporary, like provisional crowns or temporary crowns, that material can really pick it up. Invisalign trays, clear retainers, I mean, it's bad, and there's nothing you can do. You cannot get it out. But I'm seeing some of the things come through here on the rent standard talking is closest, CLOSYS. And then advice on cleaning ortho retainers. I'm assuming you mean like build up. Soak it in a 1-to-1 mixture of white vinegar and water. It'll soften.
White vinegar and water.
Yeah, soak it overnight. It'll soften that tartar buildup, and then you can just brush it away. Feel like new.
White vinegar and water, huh?
But you can use denture, at those effervescent tabs if you need something stronger. But white vinegar and water, with any removable appliance like retainers, Invisalign trays, dentures, things like that. That's the first step. Go to.
Hey, before we run out of time, I want to talk about root canals because people always ask me, and I don't know anything about root canals. What the heck? I don't know anything about root canals. Are they terrible? I have a root canal. I think I may have one or two in my mouth, actually. Why? Explain what a root canal is. We say that word, and I don't think people know because I didn't really know what a root canal.
Okay. So
I wish we had a model of a tooth.
That would be helpful.
I know.
So let's talk about like a lower molar.
Okay.
So if you had a root canal done, an access hole would be drilled down through the chewing surface of the tooth.
Okay.
To get into what's called the pulp chamber. It's kind of like the middle of the tooth where the nerve and the blood supply are housed.
Okay.
And then from that chamber, you would essentially use an instrument, a file, to try and clean down kind of the main highway, the main canal or channel of each of the roots of the tooth. So you clean out the nerve, the blood supply, the vasculature, and then you fill it with essentially like a rubbery material called gutta percha.
Gutta percha. So that is the mechanical explanation of what a root canal is. Okay.
So let's get into diagnosis.
Yeah. Why would you have
two reasons someone could tell you need a root canal?
Okay.
If they're being ethical and honest. One, you've got a tooth that's alive that is painful.
Alive and painful.
So the nerve is still alive, but you've got either spontaneous, unelicited pain, like you lay down to go to sleep and like your tooth is just like throbbing.
Yeah, I had that.
Or you eat something hot or cold and you just want to like rip your head off and it hurts like for half an hour. It's just like, deep seated, like painful throbbing. Okay. That tooth is still alive. Nothing is infected. It's just irreversibly inflamed. Okay. It's not going to get better on its own.
Okay.
Right? That would be one reason.
Okay.
Someone can tell you need a root canal. Remove the inflamed nerve. The pain's going to go away.
Okay.
Right. The other reason you can need a root canal is you have an infected tooth. Okay. So you either have a symptomatic or an asymptomatic infection.
Okay.
So the tooth is necrotic. It may or may not be abscessed. The abscess could be acute or chronic. Acute, your face is swollen.
Yes.
You've got pus draining, rapid progression. Chronic, asymptomatic, wouldn't know it's
festering
there.
over
You take
time,
a CT scan and you see an abscess on a tooth.
Wow.
Okay. Those would be the other category of a reason a tooth can need a root canal. Okay. So again, we talked earlier, I'm not here to sway people. I don't want them to sway me.
Right.
So you've got a root canal.
Yeah.
Your decision becomes at that point, if there is nothing visible on the CT scan where we know there is an abscess, no one can tell you with certainty that there's no microorganism activity with that tooth. Okay. There can be bacteria in all the little side streets off that main canal that's been instrumented and filled. Okay.
Yes.
Whether or not that's having a systemic effect on you, I don't know. You talk about tipping point all the time.
Tipping point.
All right.
Yep.
So is your body, if something is there, is your body well enough to handle it? All right. If it's not, then, or if certainty of knowing that there's no possibility that something's contributing to a systemic issue, your piece may be with removing that and knowing that it can't be a problem. All right. If saving the tooth is your number one priority, then a root canal is the only option to address those two treatment scenarios. Right? But no one can tell you with certainty that there is not going to be a potential, infection or subclinical bacterial issue with that tooth. All right. So if you've got a painful tooth that's alive, your choice is take it out to get rid of the pain, or do the root canal to get rid of the pain.
Okay.
Right. if you've got an infection and it's already dead and already infected,
the tooth is already dead, or the whole system
like
is
if
dead.
you've got an abscess,
Yes.
vasculature is done. There's no blood supply coming into the tooth, so there's nothing you can do immune system wise to get rid of that infection.
Fix it. Okay.
You can take an antibiotic to diminish acute symptoms.
Sure.
But there's no vessels inside the tooth anymore, so the body cannot do anything to mount an immune response against the bacteria in the tooth. So at that point, antibiotics are only symptomatic and temporarily effective.
Okay.
Removing the tooth or removing enough of the bacteria inside the tooth through the root canal is the only hope that the body can get rid of the abscess on the outside of the tooth. So if you want to know that it's not going to continue to be a liability or risk factor, removing the tooth is the only option that you have. Okay,
wow.
You can do the root canal and the visible signs of the infection could go away, but they could return, or there could be the possibility that there's still bacteria in the tooth, just not enough to create like a cone beam CT scan visible abscess.
Right. And Carrie said, I've heard bad stories about root canals. Why do root canals get a bad rap?
Well, I mean,
why do they? Or maybe they just do in the functional medicine world.
Groups.
Okay, that's what I was going to say, because I never had any issues that I'm aware of.
But I'm not here to defend. I mean, there's people can find a ton of bad information to support whatever viewpoint they want.
Lord, yes, everything, okay? Yes.
So
I just wonder why they have such
documentary that ties it to cancer. Okay.
Yeah. And there's one called the root cause, right?
So correlation with a lot of issues, no causation, which is a big difference.
Okay.
It's like saying everyone that's died, their heart is not beating. How many people that died had heart problems? So it's you can create whatever statistics you want. Okay. So I'm not defending. We don't do
all of them.
Yeah. We don't do a lot of root canals, but it is your right to know when it is a treatment option, and for you to decide if that is the route you want to go before removing a tooth and going through the cascade of what to do, if anything, to replace the tooth. Sometimes it's a financial decision.
Sure.
Sometimes it's a
absolutely
health priority decision.
Yes.
We just had this poor girl. She's 8 or 9 years old. That 2 permanent first molars, non-restorable without root canals.
What?
So that treatment decision is, we're going to choose to keep these teeth until we can bring the second molars down into position, remove the first molars with the root canals, because she can't have implants until she stopped growing. So 16, 17 years old. So she's got, almost a decade before,
So you think what happened to her?
Just extreme decay progression. So not about why it got there, but in that scenario, the decision was, if you remove the teeth, you are creating a significant growth and development and dental cascade for this girl.
Yes.
Sometimes it's not. Things are very rarely cut and dry.
You bet.
Decisions aren't made in vacuums.
No.
So there's a lot of priorities that go into making these decisions. So we want to be a good sounding board to help people make those.
That's one of the reasons I love them, because that was a big ordeal when I had these all these amalgams removed. And by the way, I'm sure they do this, but I'm not sure I'd recommend it again. I did all 9 of mine and started the implant at one time. Remember? Put me to sleep.
Drugs are great things.
Put me to sleep, woke up with all of them gone. And then I went to work the next day, and Dr. Calb sent me, I looked like a chip. That's normal. You've had 8 hours worth of surgery or so in your mouth. And I thought I was going to work the next day. But the beauty of what they do, and you're a good sounding board, and you listen, and you all think down the road. I mean, that little girl's 9 years old.
Yeah. That's a tough place to be. Those are tough decisions to make.
Yes. And Carrie, is inflammation the same? Is infection the same as inflammation? That's a great question, by the way. Inflammation. No. Okay. Yeah. Go ahead. You give your answer and I'll give mine, which I'm sure is the same, but.
Well, so in our case, when we're talking about, like abscess teeth or gum disease, there is an infection there, and it is creating inflammation.
You bet. That's what I was just getting ready to say.
But
I don't know. And I don't know that inflammation causes infection. Maybe. But possibly, maybe, but for sure, infection creates inflammation.
Well, in
Absolutely.
our case, we're talking about bacterially mediated
You bet.
specifically.
You bet. So what do you love? Like, if you could do anything in this office you love, I mean, what's your favorite thing to address? Because I know what mine is. Mine's Hashimoto's. Hands down, Hashimoto's and food sensitivities are my two top. Love it when I have a patient. That's what I'm working with.
Complex restorative. Taking
Complex
someone,
restorative.
just rebuilding. So taking someone that has just, worn, broken, lost teeth, rebuilding things and restoring them to what they used to be. So we do a lot of different things.
Yes.
Preventative care, complex restorative, extraction, surgery, wisdom teeth, implants, cosmetic. We want to be, as much as possible, a place where you can get everything done without having to go to like 5 different places. Now there are reasons that we'll need to use specialists for certain things, but if I could do the same thing every day, it would be rebuilding and restoring someone that has, just for whatever reason, broken, worn down, lost tooth health.
Wow.
So
I didn't know that. I just
one of your Hashimoto
you bet.
group patients. I mean, that's
yes,
doing what we were able to do for that case.
And you're talking about the male.
Yeah.
Yes.
Yeah.
And he is so proud of his teeth. He looks like a completely different person. And this man is nearly 70. Yeah. And so it's, there's nothing like your teeth. I mean, that's the first thing people see. Yeah. So if you don't live locally, or you can't get to, a dentist like Dr. Jones, for sure, the tips he gave us, taking care of your teeth.
Well, not feeling like you have to separate, being proud of the way things look and having world-class cosmetic work from having, a provider that's going to, be in tune with your overall health and have conversations with you about what you're putting in your mouth or taking out of your mouth. Yeah. It's going to be connected to that.
Well, and the beauty about them here that I have known for 10 years is they are huge on education. Your hygienists are educating you. They have every time. I mean, I know it's not just me, because I hear it from other people. They're educating you nonstop from the minute you walk in till the minute you leave on.
Doesn't stop. Okay. I mean, there's always new stuff to learn.
That's exactly
but
right.
We're learning from patients too.
Yeah, and that's something.
And it's like we can't keep up with every product that's out there. So learning I was like, I tried this. It's been great for me. Like I love that interaction too. It's just too much.
I do too. I love what we do. I think that I love what we do. I mean, we are traditionally trained providers, you and I, and we do a lot of traditional work. I mean, absolutely, and we'd be remiss not to do that. I mean, but the fact that we've stepped out of the box and have got and realized, right, that there are other ways to treat things and other ways to do that. I just find it fascinating, and we're constantly learning. That's the beauty of it. Yeah. When you practice something like what we do, you're never bored, because, oh my Lord, these patients come in with things that throw you for a loop every day. And I have never heard of that in my life, but let me look that up.
Well, that's why I just say, every patient is not making a decision in a vacuum. There's factors, that are going to affect, regardless of what they have, what they decide to do as far as timeline, priorities, budget, but, on our side as well, you can't treat everybody the same way.
No, absolutely
there are going to
not.
be different things that are going to be more of a struggle for one person than another. There's going to be different. You've got to prioritize treatment. You need to have someone that's going to be taking a 30,000 foot view of everything and actually walking you through start to finish. This is what needs to happen. Sorry, I'm shaking. Getting fired up here. No, you've got to have a plan to where you understand. Okay, this is what success looks like. This is where we're going to start. This is where we're going to end. And the case we were talking about, whether or not that's a 2-year process.
That's right.
Or whether that's I want this done in 2 months. Can we make it happen? There's a lot of different ways to go about stuff.
You bet there is. There's more than one way to skin a cat here. We're going to answer this question. Cheryl, should crowns be made faster in the office or sent to a professional lab tech?
Should they or could they? I don't know if that's a could or a should. So we have CEREC technology, which is a CAD/CAM system in the office to where we can take digital impressions and in a lot of cases mill a crown in the office. You leave with the permanent crown cemented on you. You don't have to come back to have the permanent put on at a separate appointment. There are scenarios where we will do that. There are scenarios where we won't do that. So if we're doing, cosmetic work, veneers, crowns, redoing a smile, we're going to send that to we don't use non-high-end labs, but a high-end lab that is going to create a restoration that we can't make here in the office in a single visit, meaning it's going to be milled out of a substructure, then it has multiple layers of ceramics put on that to create the vitality, the translucency, the natural look of a real tooth that we can't do in a 2-hour appointment here in the office.
Oh.
But on a back tooth where you don't need that level of aesthetic attention, meaning like layering that would be required on a front tooth, it can actually be better. It's less traumatic. You don't have to get numbed again. Your tooth doesn't have to be worked on once to be able to put the permanent on in a single visit. So both have their places.
What should people look for in a dentist? But also, Cindy, I think all the things we talked about tonight too.
Oh, man, such a loaded question.
It is. It is. And I think it's different for everyone.
Someone that's not going to get threatened by you asking questions. Someone that's going to be looking out for you and not just your tooth.
Mm-hmm. Looking out for you and not just your tooth. Oh, I love that. Well, and it's going to be questioning things too, about heart disease. And there's a connection between oral health and Alzheimer's disease as well, correct?
Yep. I mean, the amount of stuff periodontal disease is linked to, multiple types of cancer, type 2 diabetes, HbA1c control, Alzheimer's, dementia, heart attack, stroke, high blood pressure, hypertension. And then the triad of that with sleep apnea. There's so many. You go off the rails on so many different topics, but it's all related.
Sleep apnea. I'm getting ready to have Dr. Bill Noah on Sunday night service, who owns sleep centers in Middle Tennessee. It is fascinating. Yeah. Sleep apnea is.
It's a killer.
It takes on average 10 to 16 years off of your lifespan. Untreated sleep apnea, a decade to almost 2 decades off your.
I do not think there is a single independent risk factor more tied to heart attack and stroke than untreated sleep apnea.
Did you all hear that?
Even previous history of heart attack being on that list.
Yeah. Yeah, it's going that, and he's not going to do Sunday night because he doesn't want to do Sunday night. He lives out in the country. He's going to come in and do it on a Wednesday night. So we're going to have a Wednesday night church service. I feel like a preacher. Sunday night service, Wednesday night service. Right? I get on my soapbox every day. You will not want to miss that. That's will be one of those midweek things that he is brilliant, and he. Snoring is the loud killer. Absolutely. But there are people who don't snore at all, who have sleep apnea, who just don't breathe.
Yeah. And, if you've been treated for high blood pressure and all the answer has ever been like, take this medicine, and you may not, I'm not saying you have sleep apnea, but go to a provider that is trying to find the cause of something and not just medicate you through something.
You bet.
Right?
I mean, the youngest child that I ever had diagnosed with, because I don't diagnose it, but with sleep apnea, he was 13. 13 years old and has this. Well, that was almost a decade ago, so I guess he's in graduate college.
You can 3-year-olds. Different than the adult that's got they're overweight and have comorbidities and have obstructive sleep apnea. But a lot of little kids, if your kids are grinding their teeth or they've got a lot of wear visible, there is no 3-year-old should have enough stressors of life to be grinding their teeth.
No.
But the front to back grinding motion is airway stimulating. So if they've got tonsil problems or airway constrictions, if you're hearing your kids snore or they're wearing their teeth, you need an ENT or a dentist needs to look in their airway.
You bet.
If you've got ADHD problems, if you've got chronic bedwetting problems, a lot of these things can be related to how they're sleeping because they're not breathing well.
Isn't that something?
Yeah.
And the grinding of the teeth also and the bedwetting can also be related to something that I have really dug deep in the last couple of years, and is adverse childhood experiences. What's going on at home before the age of 18. And people don't think to ask about that. Mm-hmm. That child could have lots of things happening to them that we aren't talking about. And so all that being said, we got to get back on a happy note over here, because adverse childhood experiences determine, you know, a whole lot about the rest of your life. Do you do bonding here? I never even thought to ask that. Yes, Kathleen, they do bonding here. So there we go. All right, guys, how are they going to get in touch with you? So I've got your website up here.
So, I mean, we've got a couple
What's the
tools.
best way?
We've got a couple tools on the website. One is an Ask the Doctors feature where you can submit a text question, you know, that come straight to us. The other is we've got virtual consults now where you can actually submit a couple photos and describe your concern. That's more of a cosmetic focused thing. You know, if you're wanting to get ideas on how to address something that you want to change the look of, where we can record essentially like a recorded answer to your questions and get that sent back to you. But those would be the two easiest ways if you want more information about a particular topic to go through the website to do those things. If you are looking for a new dental home, starting with a comprehensive new patient, you know, appointment is going to be our kind of our jumping off point, you know, where we've got all the records and, you know, everything that we need to diagnose everything that's present, make sure there's no, you know, hidden things that haven't been, you know, found to that point. Or, you know, a lot of people come in and still never had a CT scan taken.
Yeah. I had never had a CT. I was 44 years old and never,
it's not, you know,
45.
it's not, a lot's changed in the last decade as far as the availability of that. But, it's a game changer. I mean, there's no way to work without it.
Yeah, that's something. I just appreciate you. Thank you for being here.
My pleasure. It's fun.
Do you have anything else you want to say? Anything about anything? You can say anything.
Pretty dry at this
point. But I'll listen to him. He's talked and talked and talked. I appreciate you doing this. I mean, you've done this like 2 weeks in a row or something, 3 weeks in a row. I don't know what you did when you did Roxanne.
Oh, no.
You're getting used to it now.
Yeah.
Oh, was it a while back? Okay. A couple months ago.
Not too long.
But that's more than you've done anyway. So I think you did great. Show him some love. Show him some love. Broke him down. Oh, I have been so adamant about getting this done. And so, but I really appreciate you guys. And I mean, if you're looking for a dentist, they're my people. And I mean, he's not the only dentist here. There's another dentist here.
Yeah, Dr. Estes. Yeah, he's been, it'll be 3 years in September.
That's hard to believe he's been here 3 years.
It is
wow.
moving quick.
But, you know, from the front desk all the way back, they are high class, class A, the top of the line. And again, it's the only place that I've been. And I love you guys. And I appreciate everything that you do for me, that you do for our patients at Integrated Family Medicine, because we love you for darn sure. And they come and sing your praises. But guys, next Sunday night is Memorial Day weekend. So we're not having Sunday night service. I accidentally scheduled somebody. I got to cancel that one. And we're not doing Sunday night service because I'll be in Kentucky having a final yard sale at my mom's. The book is on pre-order. Wild and Well, you know, was #1 there briefly. My book for new thyroid book releases. It'll be released November 9th, but you guys need to pre-order it because that's how we get to the top of the list of the New York Times bestseller list, which is my goal. What's my goal? I mean, I'll take Wall Street Journal bestseller and USA Today, but New York Times would be really a kicker. But I can only do that through you all because period. I can. That's the only way. You guys need to go see Jackson and Britt in the new supplement store. It is 3 times larger than it was. It's fabulous. But June the 3rd, and I wish you were going to be there. Maybe you can. June the 3rd is our clinic crawl at the office. Mary Chabinko is going to be there. Most of our vendors are going to be there. Most of our supplement reps are going to be there. We have now 5 functional medicine clinics in my complex. I was the first one at the very front. Dr. Charles Bell is there, DO. Dr. Amanda Ryden, MD, is there. There's another DO who just moved in. I just completely forgot his name. And then Lori Powell, who's an acupuncturist. We are doing a clinic crawl. We're going to start at my office, and then you all are all going to meet all the new providers in their offices. We're giving away giveaways like you've never seen that night. We are having a big supplement sale. We're having Scout and Cellar wine, crunchy makeup stuff, all food from herb, all kinds of stuff. There's all kinds of things going on. And it's Jackson's going away to medical school farewell that night.
That's awesome.
I know, isn't that exciting? Yep. That's June the 3rd. And then guess what? June the 6th will be the next Sunday night service. That's hard to believe. Dr. Felice Gersh, holy cow, OBGYN. She wrote PCOS, SOS. She is a leader in the OBGYN field. She just did a landmark paper on estrogen and heart health, lack of estrogen creating heart attacks in women. Dr. Felice Gersh, I'm thrilled to death. I asked and she said yes. And then the very next week, June 13th, is Dr. Terry Walls, the Walls Protocol. Do you know Dr. Terry Walls? She cured herself of multiple sclerosis a long, long time ago. She has the New York Times bestseller, The Walls Protocol book. She works for Cleveland Clinic. She was in a wheelchair for years. She was in a recumbent chair for years, couldn't walk or anything. 100% reversed her MS by diet, paleo. She used paleo diet. Now she has like a autoimmune paleo thing she does. But 2 weeks in a row are going to be like rock stars on Sunday night service. I'm really excited, guys. But listen, I appreciate you all. Oh, yes. Mary says, come on, Doc, join the fun at the clinic crawl. June the 3rd, you are? Oh, man. Well, all right. Well, I want every single one of you there from 4 to 7 that night because we don't ever have a supplement store sale, and we're going to have a big one that night. All right, guys. I appreciate you. Thank you for teaching us all about oral health and how important it is.
I'm sure there's a ton of questions we didn't get to.
Well, you can answer it on your page.
Yeah, that's easy to do.
So we'll answer the questions that didn't get answered. But, big one is, oh my gosh, you don't need much toothpaste. And I'm using my entire water pick wrong tonight. And, and they're gentle dentists, not general dentists.
Right.
Gentle dentist. That's what I heard you say was gentle dentist.
That's not a bad thing.
Anyway, no, you want your dentist to be gentle because